Okay. Hello, everyone. I am Dr. Rashid Hassan, founder and CEO of DentoScope Institute of Advanced Dentistry. And today I am joined by Dr. Rabia Khan, who is a very well known speaker both nationally and internationally. And she is today sharing her all the experiences about the different career opportunities that Pakistani dentists have in UK. So welcome Dr. Rabia to Dentoscope Studio.
Thank you, Dr. Rashid. Pleasure joining you at your studio and looking forward to the interview. Thank you.
Okay, first of all, I would like to introduce Dr. Rabia to all the audience. Dr. Rabia graduated from Bakai Dental College, Karachi, and then she went for, I guess, a certification course to Japan. And then she did her master's degree from Queensberry University of London in oral pathology. And after that, she joined her parent institute, the Bukai Dental College, as an assistant professor, and she was working there in oral pathology department before she left for her PhD. So right now, she is a PhD scholar. She is doing her PhD. So we will get a lot of information from her because she is staying in UK for more than 3 years now, and she has multiple experiences of working and studying in UK. So, first of all, Dr. Rabia, first tell us about yourself, like what you had been doing here in Pakistan after you came from Japan. What was the certification course that you did in Japan?
Yeah. First of all, I would like to say thank you very much, Dr. Rashid, for a lovely introduction. And after my graduation, as usual, I was looking for postgraduate studies, and I went for a oral surgery PG certificate, and I did my that certificate from Japan. And I think that was the first point which kind of gave me the motivation to do more postgraduate studies because it was highly professional and skillful kind of a course. And I would still say that that is one of my best experiences in life, to visit that place and do that course. And after that, when I came back, I started looking for different postgraduate courses which I can do professionally in terms of taking a degree in dentistry. Yeah.
Okay. Okay, let's now come to the topic, which is today's topic. So the first question is that what are the different career opportunities for any dentist who graduates from any Pakistani university? Let's suppose I am a fresh graduate and now I want to pursue my career in UK. So what are the different opportunities available there?
Right. Simply, I would like to answer this question that there are basically two types of opportunities, whether you want to go into academic or research area, or, or you want to go in clinics. So according to that way, you can decide your pathways of your careers in dentistry. And even in academics, you can mold your career into clinics. But there is two separate things in which you can select your pathway. And I'm sorry, I just want to say this that my throat is a little bit low. So,
You are very clear, you are audible, no worries. Yeah, you can
all right,
continue.
thank you. Yeah. So, if I would like to start from academics, basically, academics, you can have your diplomas, PhD certificates, you can have your master's, MPhils, masters by research, if you want to go into academics. And for that, you have to, of course, apply for those courses and you have to skim through all the universities. And if you want to go towards clinics, then you can take a route of ORE, which means Overseas Verification Exam for International Dentists. And you can start, you can take those two exams and you can clear those and you can start your journey here. And when it comes to clinical part in academics, so you can go for those clinical masters also, and then you can become, consultant or a specialist in dentistry.
Okay, I have a question here. What most of us think and see that those who do master's degree from UK in any subject just to get a faculty position here in Pakistan. But if we want to pursue our career in UK, right, then is the master's degree in any subject, any field, is that enough to get any faculty position in any university in UK?
Okay, that's a very tricky question. And of course, definitely, when I came here, also, this was the first question in my mind as well. So I think it really depends upon your master's course that you're doing. First thing I want to clear here, let's say if you're getting a visa for 2 years for your master's from 2018 to 2020, the day you're going to get your visa ended, you have to go back to your country. And before that, you have to have your job in your hands. So, it's not very easy pathway to get any faculty position after your master's because, first of all, international dentists have, for the credibility of our degree, we need to clear the exams, and 1 year or 2 year of master's is not too much enough to gain any faculty position. And faculty position is a totally different thing. It's a totally different pathway, and it
You are
starts.
you are
Yeah,
talking about UK faculty
I'm
position in
talking
UK,
about
right?
UK. Yeah, yeah.
Okay.
So it's a totally different pathway to even become a lecturer here because for that you need to have your PhDs, and then you have to have a funded project to start your journey as a lecturer. So it's a very difficult pathway to get a position in a university faculty position. But I won't, demotivate anyone. Definitely, there are other pathways after masters that you can do and pursue to stay in UK and continue your studies. And that also depends
Okay.
upon your, yeah, you can continue. I
Okay.
can answer in between. Yeah.
Yeah. Okay. Like I have decided to go to UK and do some master's degree there. So, what is the first step that I should be taking right now? I'm a fresh graduate, just completed my house job, and I want to go to UK to. I have taken admission in any. I want to take admission in any UK university. So, first of all,
Mhm.
can you give me the our audience the names of different renowned universities where I can get admission?
Right. Well, I can give you a lot of names, but I would just like to say that people who want to, who doesn't know, and this is a very big trick which everyone should know, is that everyone wants to apply to London for their masters or PhDs, and then there is a whole UK behind in which you can apply as well, and that is your outskirts of London. So London is apparently extremely expensive, and whether you take degree from London or north or any outskirts of London is the same thing. So I can name few of the universities in which I have experience in. I have experience of 4 universities, and that is Queen Mary University of London. Then I have Sheffield University experience, Lancaster University, and University of Salford. So I would say that these are the very good universities, and the system, if you'll understand, you'll get through easily. One thing I want to mention here, the most important thing is that when I was doing my master's, there was no post study work visa. But from 2021, they have started this post study work visa. So after your master's or your PhD, you can stay here and get the visa of 2 years, and you can look for the jobs and explore your opportunities.
Okay, okay.
Yeah.
So these are the different universities. Like you have mentioned, according to your experience, the four different
Yeah.
universities where you have studied or you have gained some experience there. So, are there any other universities in the outskirts? Except most of us, well, we think about London. London is UK for us, right? We
Yeah.
don't think about the other these outskirt areas which also have good studies and good universities as well. So, are there any other outskirts areas which you want to mention here for the
Yeah,
audience?
I would say that Manchester University is really good. University of Sheffield is really good in terms of like dentistry. And then you have Newcastle University, Nottingham University. And then I would say that you can do your master's and PhD in any subject. It's not something that you want to go for your dentistry specific subjects. Uh, Academics really here means that you are going to explore your research skill as well, because in Pakistan, I would see that there are research which has started now, but it's a whole different story here in UK. So if you want to begin your journey, you can apply in any kind of university out of the London. And in London, we hear about King's London College as well. These are really good universities, but I would just say that your living is going to be so much expensive that after masters you have to come back then, until unless you have
Yeah,
like a big funding and you have
yeah. Obviously, we will come to
plans.
this expenses side as well. So okay. What is the first thing that I need to do? I mean, I want to go to UK and pursue my career. I'm here in Pakistan. What's the first step I need to take?
Okay, it depends upon your, of course, interest and your circumstances and your the thing that you want to pursue. Like, let's say if you want to go into, if you want to gain a position in your Pakistan's faculty and you want to do a master's, of course you want to apply for the master's. And for the master's, each and every university has their own master's course available with all the fees and funding information, their contacts, their complete detailed information in which you can directly apply. And definitely you need to have your IELTS done. And before, I mean, without IELTS, you can't do anything here. So you have to have your that level of IELTS, and then you can apply. You can apply for with your
I think.
credentials to that university.
Well,
And
I think
then
every program or every university have different criteria for IELTS, or is it the same?
it's more or less the same. I think the whole score you need from 6.5 to 7, and it's same for ORE as well, ORE and LDS. So you need to pass your IELTS first of all, and then you need to have your credentials get approved by the university or the GDC, that is General Dental Council, and
Okay,
then you can apply for anything you want to go for. Yeah.
okay, okay. And once I get admission, do I need some specific consultants or these consultant companies, or I can directly apply to the university?
Well, I did it myself, everything, whether it's PhD or master's or anything. But you can go to consultants if you think that you're not that confident, but they're just going to take some money from you. And it's the same simple process. And I would say that everything is present on the websites and online. You just need to, get some courage to do it.
But
And you can talk to your supervisors directly as well regarding your masters or PhDs.
documentation is the main thing that I think that UK pays very too much attention. They pay too much attention towards the documentation. Maybe that's why people prefer going to the consultants so that their documentation thing is good. Not everyone can be an expert like you, but there are people who just want to be on the safer side, right?
Yeah, that's right. Because, of course, with the university, it's very easy to get the credentials approved. But definitely, when it comes to the visa process, it takes a lot of careful steps to be taken in
Yeah.
terms of taking the CAS and ATAS from the universities.
What is this CAS and it has? I mean, I don't.
This is actually basically the main requirement from which you get the visa of UK. CAS is basically for our dentistry, and it's like a permission letter that you can get the visa. And in terms of a TAS, it's for engineering purposes. It's same like CAS as well. So yeah, and also I would say that not only these things, but for masters as well, if you want to, as I said, that it's more research related and whole academia, and it's totally different world. But you can also apply for your clinical masters, and that is also known as MClean Dent.
Hmm.
So you can explore your research, skills, and then you can have your clinical expertise as well in that kind of masters, and you can
Okay.
become consultant afterwards.
Okay. Okay. So these are the main things. Like you need to be very good in your documentation, and your their requirements should be fulfilled. Uh, the university requirement should be fulfilled. This is
That's correct.
this is something related to the university admissions. Now, if we talk about the other thing, which most of the young upcoming dentists they have in mind is the ORE.
Yeah.
doing the ORE, the going and starting practicing in UK. So, what are the different options for practicing in UK? Right.
Yeah, I mean, there is straightforward these two options, ORE and LDS. There is no other option.
Okay.
So, because you are an international dentist, whether even from your Europe, you have to clear your exams. And then for those exams, of course, there are like two parts related to it. And GDC, General Dental Council, is an organization which holds these two exams, and that is responsible for all the dentists to practice in UK. So part
Mhm.
one is theoretical, part two is practical. Part one, all the recent graduates of Pakistan, I would recommend that if they will give this part one ORE exam straight away, they will clear those exams because our curriculum is really, I would say it's really up to standards in terms of, cramming and all that. So they can give the exams. And for part two, definitely you need to have your practice done here in UK so that you are able to understand the rules and regulations here on the mannequins, and then you can
Mhm.
give your part two. The basic hurdle in GDC, like ORD and LDS, is that the bookings get booked very quickly, and because it is from whole of the world, people are applying,
Mhm.
so you don't get the number to get
This is
to get it.
this is you're talking about part one of the
I'm talking
ORE.
about both parts, part one and part two. And part
Okay.
one within 5 years, then you have to clear your part two as well. So it's really tricky to get the booking done first of all,
So,
and
what's
then yeah,
what's
and
the
then you have to
difference
go for
between?
rotational
Sorry,
training. Sorry.
sorry. Yeah, sorry.
Yeah,
So,
so then
what's
you
the
have to go
difference?
for rotational training, and then you can start practicing. So there are like number of hours that you have to do in the clinical practice, and then you are just licensed doctor, dentist here. Yeah.
Okay. So, what is the difference between the ORE and LDS? You mentioned two things, ORE and LDS, and the
Yeah.
and difference between these two.
Yeah, ORV and LDS, basically, these are basically for both, both are for international dentists, but both have a little bit different exam pattern. LDS happens once in a year, and ORE happens twice in a year. This year, due to COVID, nothing is happening, but different exam patterns, and then for IELTS regulations are different as well in terms of, I just got the question popped up here.
Yeah, yeah.
Yeah.
This is a question for you.
Right. So I'll just answer this and then I'll give the answer to this one. So
Yeah.
yeah, and then for LDS, you have to have I think there are IELTS difference requirement, but I would say that both are for dental international dentists, and both have a little bit different pattern of exams. But if you're not getting an admission in ORE, you can go for LDS. So it's more or less the same thing. Yeah,
Okay.
but and there is a difference, a little slight difference in their fee structure as well for both parts. Yeah.
Why? I mean, you can through ORE. Is it LDS is only for some specific areas or so?
No, no, that's for whole UK as well for all the international dentists.
Okay, okay, okay. So that
Yeah.
clears about it. So, so there is a different exam for LDS and ORE, and
Yeah,
it's the same part one and part two, right?
that's right.
Okay. So now this is the question for you, Dr. Abhi.
Yeah. So Namra did her MPhil oral pathology from Pakistan, and what can be the opportunities from in UK? So, I mean, again, it depends upon her complete interests that what she's going to do. MPhil, she can get herself, coordinated with the universities, whether they, um, give her the opportunity because she needs to get an admission. If she wants to go towards academics and she wants to continue her oral pathology PhD, let's say, or master's, let's say, so she needs to contact the supervisor and give her credentials. And if she can get even her PhD done, if they agree to the approve to the credentials she's giving, and then she can get the PhD, because for PhD you have to give a massive interviews, and if you are getting selected for that, then you can enroll in your PhD, and it has huge extensive amount of fee structure as well. And when it comes to MPhil or pathology, and if she wants to pursue her master's, it's the same thing, that she has to contact the university and she can get admission and she can start over. And then the
So
third thing as well, she can go towards clinical part also. But oral pathology is a basic science subject, so I would say that um,
this is
I
related to
don't.
your field, Dr. Abe. You also did your master's in oral pathology, right?
That's correct.
So
But I did it
if,
from UK,
yeah, you
and
did
then
from
we
UK.
didn't have.
If Dr. Namra, if she wants to pursue her studies in UK, she will have to get enrolled in masters leading to PhD sort of program or something like that.
Yeah, that's what I'm saying. That she can, coordinate with the university and to the level that how they are coordinating with her. If they think that she's eligible for doing a PhD, she can get a PhD directly. But PhD, the most important thing I just want to say here, people shouldn't be thinking that PhD after masters. I just want to do PhD to gain that degree. PhD
Hmm.
is just not a degree. This is not something that anyone can do. I'm not saying because I'm doing it and I'm something, but I'm saying it because it takes a lot of motivation to finish this PhD.
It should be goal oriented.
It should be
Something.
goal oriented. You need to be highly, extremely motivated to do it. It's not an easy task. Your circumstances, situations, your financial situation, everything counts. And then for PhD, I would say this could be very um, unusual to listen actually, but PhD is the first step to research. That is the first step, not the end of studies, not the end of everything, but this is the first step of research. And then you
That's
know that how to develop a project, and then you can do the things. So I would just highly recommend this to everyone. Do not think of PhD until you are highly motivated and you have all the situation and circumstances in place and in your favor, and then go for it.
very well said, Dr. Rabia. So, okay, let me ask you some other questions. So, you just like any other graduate, you also did your you just did your BDS. Why you went to do the masters? Why? What was the motivation or anything like that? Was it just to get a postgraduate degree and get some job at that point of time, or there was something else you want to share?
Yeah. Yeah, I would say that I am an extremely motivated person, but definitely after graduation, I had no idea what I'm going to do. The only thing I wanted to do is to do post graduation, right? Because getting a demonstrator job or lecturing or like doing the clinics was enough for me. But at some point, I stopped and I said that I want to do something else as well. So my motivation was that PG certificate from oral surgery from Japan in oral surgery, and then I got, because in that oral surgery everything was related to oral pathology as well. Everything was connected to all the diseases were being cured and treated in the oral surgery department, and that's how I got interest in oral pathology and oral surgery. And then I looked for the options in Pakistan as well. And then basically, like it's hard to get admissions. I didn't though give any exams, but it was an option for me, which I thought that I can learn a lot in a short period of time. But I think when I came here and I went back to Pakistan, I thought that this was not even an initial beginning of my studies, basically. And then I craved for more research and more studies. And then that's how I applied for PhD as well.
Yeah.
But I would say that, you really don't know that after graduation what you're going to do. It's something that you learn with time, and you should be exploring your options all the time, because it's not only UK that I had applied for, and it was like so many of countries, and I gave so many of interviews, and I luckily got cleared in each and every one of those. But it really depends upon your supervisors, and I would definitely say that for your whether it's your master supervisor or your PhD supervisor, it's extremely important that you get a good supervisor, and that's how he's going to shape you. And I would say I'm very, very lucky that like my PhD supervisor is an amazing person, and um, to get a support. Just a moral support is extremely important to get your PhD done. And that's why this is another important tip, that when you're applying for masters or PhDs, you should be looking for your supervisors, their degrees, their credentials, their reputation. And if you can talk to some old students, it will be good as well, to speak about your supervisor, because that's the way your supervisor is going to treat you, that's how you're going to become. So it's really important to shape your professional and personal life in terms of the supervisor that you're going to have.
Okay, okay, very well said, Dr. Abe. Okay, that what I also wanted to ask, that you already did some postgraduate course in Japan,
Yeah.
right, in oral surgery. Then why you came to UK for masters? Why you chose master? Wasn't that certification course enough for you to pursue your career in Japan or anywhere else in the country?
Yeah, for Japan, actually, there is a language barrier basically, because it's very difficult for them to communicate in English. So for that, I need to learn their language, and I have to, because I did looked for PhDs in Japan as well, but then it was very difficult to communicate basically. And
So
then UK is something,
which was
yeah.
the university in Japan? I mean, can you tell us the university?
Yeah, it was Surumi University, and then I applied for PhD in Tokyo University.
Okay, okay.
So yeah,
So
I
there
mean, I
are
think that
English language courses available there as well.
I mean, English. They do try their best to speak in English, but and you can get your PhD from Tokyo University in English, but it was difficult to like it was a bit of struggle to continue your studies there, I would say. And when it comes to UK, I would say that I learned it from my seniors, that everyone was going to UK, and that's how I went there as well, because I was a normal graduate also. That that I mean, because UK was the first option and the first thing which I was hearing from my university, and then I applied for UK. I did not apply for anywhere else. That was my first university, first admission, and the first place to go. So there
So
was no
you're
exploration at all. But for PhD, I did a lot of exploration, a lot of countries, and a lot of interviews and everything. But for masters, I was sure short. It's oral pathology. I want to go to this university, and that's it.
so your main aim at that point of time, being a young fresh graduate, was just to get some postgraduate degree to earn some living back here in Pakistan, right? At that point of time.
Um, I mean, you can say that, but as I said, that started from why do I have to do any post graduation as well? Like we don't have the mindset. Now it has been started, but we don't have the mindset of doing post graduation. And I think motivation started from that oral surgery course, and then it ended up into that postgraduate course. But then I would say that um, as that oral surgery course changed my whole mind towards like oral pathology masters. Oral pathology changed my mind completely towards research then. So it's something that you learn things with time and experience. So because oral surgery is connected to oral pathology in Japan, which is really not in Pakistan and in UK, oral pathology is completely different and oral surgery is completely different. So this is what I was expecting in UK, but I didn't get that though. But I did get the research from my masters. So
Okay.
yeah,
So let's go back to the questions that I was asking you. That okay, if I want to pursue as a general dentist, the first thing is to decide if I want to do LDS or the ORE
already.
exam. So, is there anything? Okay, part one. You said that part one is easy. We can clear it, but it all depends on the availability of seat, right?
That's correct. Yeah.
And but for part two, what I want to ask, is there any change in the clinical work ethics, you can say, here in Pakistan and that in UK, that or we have to take certain workshops, or what we have to do to clear the part two?
Yeah. I mean, definitely you have to take some practicing in here in UK, because it's a lot difference between Pakistan's clinical practice and here, because there is a whole dental team that completely supports the dentist here in UK. You do have dental hygienists, dental nurses, technicians, and uh, dental therapists as well. And then you have to have your complete practicing done on the mannequins here to get through into the vocational training basically and to pass through the exam. But when it comes to Pakistan, it's a totally different way of doing the clinical practicing, because of course, I'm sure you can understand that the kind of we do everything first of all on the humans, but yeah, you need to have your preclinical assessments and preclinical training as well before you get onto the individuals particularly.
Okay. And definitely that will increase the cost of these examinations as well, because you also include the cost of these workshops or the courses that you need to take to make yourself eligible to sit in those part 2 examination. So that will also add up to the cost of the
That's
exams.
correct. That's correct. I mean, you can, I give you a range. I won't say that particularly because it keeps on changing every year, and you should be looking at GDC websites all the time, because the updates and the rules and regulations are there, the applications are there, the course material is there. So every process is on the GDC website. So I would just say that it starts from thousands, £1,000, and it goes up to £3,500, and then along with your living and practicing, it goes up to like 5,000, 6,000, about 10,000 maybe. And so you need to be completely aware of the finances that you're going to have for OREs, LDS, and the masters and PhDs as well. One thing which I want to again mention here, which is very very important, and no one actually in dentistry is aware of these kind of things, because when we think about any postgraduate courses, everyone thinks that, oh, I just can't do it because I don't have the enough finances for it. But I would say that there are availabilities of scholarships in Pakistan as well as in UK also. So do not underestimate that what we have in Pakistan, I would say, because there are HSC scholarships, there are Commonwealth scholarships, there are so many of different scholarships, which I can say that I have the living experiences being with those individuals who came from those scholarships from Pakistan. So you need to look for those scholarships which are in Punjab, which are in, like for HSCs are the our government ones, and apparently the people I have met here are mostly from those areas, and they have taken scholarships, complete scholarships of their PhDs from Pakistan. So you just don't need to like lose the hope that I can't do anything from UK because I don't have the finances or circumstances for it. And the only thing is to explore and do not like give up. I would say that the thing which is lacking in Pakistani dentists is that they don't explore the things much. If you're going to keep on exploring, if you're going to keep in touch and in contact with all the authorities in Pakistan and all the UK universities, relevant departments, you will get a great amount of knowledge. And then you can like, luckily, I have seen people, I mean, not even from the people who are from those areas, the Nazran and the Punjab areas. I have seen people from my own class fellows, and not exactly class fellows, but in my university's students who has got scholarships and who came to UK for their masters and PhDs. So just
Yeah,
my big tip is to just explore and talk to people and ask about it. That how is that going to happen? There is not always a straightforward way to get to a thing. So if you want to do something, you can always get a way through it, through all of these things to follow.
funding is indeed a very big issue. The first thing that comes to anyone's mind before when they think about going to UK and pursuing their career in academics, I would say, not only in paying the fee, but also in terms of the living expense, the accommodation, everything, the traveling. So how should anyone, like anyone who's going there, how can he cope up with all these expenses there if he's not well off?
Yeah, I mean, I would say that you have to do job here, and you're allowed to do 20 hours of work if you're a full-time student. And mind you again that every international student needs to be a full-time student. He cannot come on part-time or anything. So you are allowed to work 20 hours. That's written on your visa, and then you can earn your living from that. And you can earn your living from those 20 hours if you're doing any kind of jobs here, and that can be anything, and you need to again apply for those jobs. So if you're applying for those jobs here when you're coming here, you should be looking for the options when you're back in Pakistan as well, for your courses. So you can earn your living from there, and definitely you do need support for your living and traveling, because it's really really expensive, especially in London. And you need to have extra money. It's good to have your family support, and that's I really love about Pakistan, that we do have always family support. But if not, you have to work hard for it, and you have to restrict your living to gain a degree.
So is there any difference in the expenses in London or somewhere else in UK? Is there any difference in
Yeah,
fee
definitely.
structure or something like that also?
Yes, definitely, because London is, of course, huge, and it's a metropolitan city. And then the traveling, they have a huge, big system of trains here. And then accommodation, a very small apartment is going to be very expensive in terms of living. And then we come from big houses from Pakistan. It's really not like that here. And then your traveling is also very, very expensive. When it comes to outskirts of London, it's a bit cheaper. I won't say that a lot cheaper, but like a bit cheaper than London. But you can still afford your living with those 20 hours of
Well,
um,
okay,
work.
Dr. Abia, the universities where, let's suppose I've taken admission in any university, do they also provide accommodation? Number one, and number two, is that cheaper than the accommodation elsewhere if I find it by myself? So what's the difference?
Student accommodation is always, always, always expensive than the other accommodation from the university, and a lot more smaller as well. So I would say that, of course, if you're a fresh graduate, you're moving out from your country for the first time, you can stay there for a month or so, but then you need to get out of that accommodation and look for another accommodation to live in, because that's extremely expensive. That's going to cost you like thousands in a month. And
What
yeah,
a- what
I mean,
about the
once you're
accommodation
here, you
outside?
can look. Sorry.
I said, what about the accommodation outside? You're talking about the within campus, the accommodation in campus or accommodation. If I take the accommodation outside, so how much that's going to cost me
That's
as a
going to cost
student?
you like, it depends upon your, again, I said that, how much restricted you want to be, but it can be as half as your university's accommodation as well. So
Okay.
you'll have an options to do it. And then once you're here, you can work around your ways. That's not a big problem, and that's not something a big issue. But yes, you definitely have to work if you're not completely rich from back home. And then you have to work your own ways, in terms of your studies and all. So yeah, but I would still recommend that you should be looking for something which is feasible to your bank accounts and your specialty interests and your circumstances, I would say. So that would be more appropriate to go for. And I would say do look for universities out of the London also. And this is the
Mhm.
biggest tip, like no one takes it seriously, because we follow the crowd. Okay, our seniors are going to this university in London, I am going to go there as well. So this is not the way. You should be looking for the options and explore your options by yourself, and then go for that place. Because if you'll get a degree from London, or if you'll get a degree from any north, or like anywhere, any town, it's going to be the same. It's really
Mhm.
going to be the same, until unless our PMDC is going to recognize it, because there is another issue.
No, Because we are talking about pursuing the career in UK, so it doesn't really matter, right?
It doesn't matter
Uh,
as well.
uh, okay. Once I complete my master's degree, then is there any opportunity for me to get enrolled in PhD? Because as you said earlier, that master's is not going to be enough for me to get a faculty position there in any university, right?
Yeah.
Are there any opportunities for PhDs there?
Oh, after PhD as well, you're not going to get any job here. It's not that easy. I mean, after PhD, you can. I would say you need to be extremely lucky to get jobs in these kind of countries. But I would say that you can get a postdoc, and in which you're doing another project, and you can take the funding from those organizations, and you can get the I would say that, as I mentioned about the post-study work visa, for those 2 years you can look for your postdocs, and you can do your postdoc done after PhD. Then uh, if not, then you'll be doing the same jobs that you're doing for your 20 hours. But to get a lecturership is a huge, long, far-fetched.
Lectureship is just like being an assistant professor, or
Yeah, that's
here
correct. And it's
we
really
can
difficult.
compare it.
Really difficult. You need to have like so many publications and all. So of course I'm not demoralizing anyone, but this is what I thought as well, that I'm going to do my PhD and I'm going to have a job. That's not the case, because as I said, this is the initial step of research. So if you're lucky enough, you can get job. um, you can start your project with your supervisor, and then you
Mhm.
can continue,
And
and
you can get the fundings, right?
you can get the funding. You can, yeah, it's a whole research game and all. So
Okay,
yeah, you
that
can
was about.
clear your ORE. You can do your ORE, and you can get yourself attached with a dentist. I mean, there are options, but it's not straightforward options, I would say, after PhD. Not very straightforward, because I have been in touch with so many of my seniors who did PhD and who, like, struggle to get a job. So I understand, the market here in terms of PhD, after PhD. Yeah.
Okay, that is understandable because you are not the only PhD there. There are a lot
Yeah.
of the whole world is, the whole UK, the people all over the world are there to get education, get the PhDs. So
Yeah.
that was something about the academics. Now, if we talk about the ORE, the licensing exam to practice dentistry, once I clear part two, then what options do I have?
As I said, you have to go for vocational training, and then you have to complete certain hours, and then you can start your practice. You can
What?
become an associate dentist, and then you can become a dentist. So you have to look for the clinics, and then you can get yourself,
Okay.
attached to those dentists, and
What?
then you can start your
Okay,
practice.
what exactly is that the number what you said practice? What exactly is that? I have completed my ORE. I have cleared my ORE part two. So what I need to do? Should I go to different clinics and apply for a job there to work for few hours?
Yes, yes, that's what you're
Okay.
going to do actually for the vocational training. You do need to go to the clinics and get the vocational training done, and then you can become the associate dentist and then the dentist, and you can start your own practice
So,
as
so,
well.
so straight away I cannot start my practice.
No, not straight away. You need to have a
Okay.
training before you get yourself individually and like solely start your things done. Yeah, you need to have a
Okay.
training before you're a full-fledged dentist here.
Okay. That's really nice. Okay, now let's talk about this ORE thing, this clinical practice there in UK. Okay, now I've being after being an associate dentist. So, what about the NHS jobs? NHS also, they also need dentists there, right? So
Yeah.
I cannot apply straight away for an NHS job. I need to get these hours, these training, vocational training hours done before that, or should I
Yeah.
straight away apply?
Yeah. You can get the training. There are a lot of different options. Like you can go into NHS or the clinics, because clinics are some few clinics are attached to NHS. Few are not. So there is a whole rules and regulations to get into the NHS as well, and um, because once you have the GDC number, if you have cleared it, then you can practice along your way, and then you can see that what is going to be the best option for you, and you can start practicing. But yes, definitely there are private clinics and there are NHS registered ones, so you have to look your options through that way basically, but you need to have a training before you do anything.
Okay. Okay. There's one thing that is coming to my mind. Okay, you are doing a PhD. You are in the research side, right?
Mm-hmm.
So can you give the ORE and do both things together? You can be a researcher and you can do the clinical practice as well. Is it the
Yes. Definitely. I mean, if I am a dentist, I can do anything in terms of my dentistry. And when it comes to my research, it depends upon my specialty and my interest, basically, that whether I want to go towards academics or research, or whether I want to go for the clinics. And I can become a clinical researcher as well. And I'm doing
okay?
a clinical PhD as well, I would say, because I have incorporated the dentistry aspects in my project. So I am doing clinical research basically.
So you also told me before the interview that you are also a director of some big organization, right? So what
Um,
exactly is that?
that's correct. Yeah. So I am actually director of
So
education and research lead
yeah, yeah. So
in a
you
dental
are you.
institution.
So okay. So that is based upon your PhD skills, or there are some other things also required because you are lucky enough to get a permanent job, right? It's a sort of a job there that you are doing. So you
Yeah.
are so
Yeah. So
so
basically, with this one,
so
uh,
you have what I want to ask is that you have an exposure of working there as well in
that's
some big
correct.
organization in a on a very big post, right? Being a director is not something you can say every some easy piece of cake. So you need to have some skills. So what are the different skills that you should have to be the part of that organization, to part of the UK system?
Hmm. Yeah. So basically, I would say that I did almost like 30 to 20 to 30 jobs here, and I do have experience in the offices, the universities, the administrations, the clinics, the NHS. So, and then I do have a lot of book chapters and publications, and then I got my scholarship in my PhD as well, due to the skills I was learning, and due to the progress I was doing in my PhD. And then I would say that all of these things and my experiences, basically, which has made me gain this sort of job. And that's how I'm going to, because in my research as well, in my PhD also, I'm doing a project with NHS. So that's a really plus point. And
Okay.
yeah,
Okay, that's nice. Okay, because that's what the main thing which I wanted to ask. You said about the publications, right? Here, I want to tell you that one of my team members, who is also very fond of research, she once asked me about a couple of months back that who is this Dr. Rabia? She is all over ResearchGate. There are so many publications because I am not in the ResearchGate, and she's there and she saw a lot of publications from your side. So and how many publications, because here the criteria is different, right, in terms of publications, and you mashallah have a lot of research knowledge and lot of publication I have seen, gone through your profile, and even I know you personally as well. So just I want to for my audience, I want to ask this question: that how much research papers are required to have some good standing in terms of any organization? If they want to see, then how many research paper, or is that the impact factor is important? So what exactly is important? Research is important, the papers is important, the impact factor, journal, what exactly is important?
Yeah, this is another a big lecture I can give on basically. So,
Yeah, you are most welcome. You are most welcome to give
right.
those.
So I would say that this research is actually publications. There is a whole. This is a whole. Research world is totally different, and I wouldn't say that 1 to 100 publications are good or not. No, you need to have an impactful publication in a good impact factor journal, which everyone says. But I would like to mention here that the most important thing is when we look for any publication in any kind of databases, so you can get a high impact factor journal, most expensive journals, and you can get good studies there. But there might be a study which is not in a good impact factor journal, but it does has a good importance and a good impactful outcomes. So I would say that which is being counted in organizations is of course a good impact factor journal and peer reviewed journal. And the importance of the publication depends upon the results of the publication, and the way the publication is being done, the research is being done. So I value like any and every kind of research studies, provided all the regulations and all the patterns have been taken into account. But I would say there is no limitations that how much publications you need to have to get any kind of a job, I would say.
Because
So
you are in the system. You had been in UK on more than one occasions, first for your masters and then for your PhD, and now you are working there in an organization as a clinical director of clinical programs, or in a very renowned organization. So that's what I want to extract from you, that what exactly, because the research thing is something very new here in Pakistan, right? We
yeah,
don't know anything about research. We just this is something that is not new, but there's not much awareness about it, right?
yeah.
So if I ask you, if I bring a CV to you, and it has, let's suppose, 10, 12 publications, what will you see in those publications on in my CV? What is the thing that you will see?
I will see. I mean, if I'm seeing like 10, 12 publications, I would definitely would like to see that what you have done in terms of your research, and what type of studies are those? Are those of the same patterns? Are those, then there are like hundreds of studies. These are case control studies, clinical trials, reviews, systematic reviews, scoping reviews. So then I have to see that in which category you're lying in, and what you have really done, what kind of range of studies that you have done that can make you a good researcher. And as I said, that research is something, not getting a publication done and you're a researcher, definitely it gives you a different kind of critical thinking that you need to have, and the range of your mind should be open for this, and um, then you can
The
manage your project. And for the management of projects and developing a study, I would say that we expect from graduates to do the research by themselves, and I'm saying that PhD is the first step to do the project management and start the research study. So there is a lot of learnings that you have to do before conducting any research.
Because Dr. Rabia, there's also a difference in facilities as well. I am doing some research here in Pakistan. The facilities are not there are not much facilities available there, but in UK you have all those equipments available. Okay, there might be some difficulties there as well, but here in Pakistan, doing research is a very big research in itself also.
But I won't take this excuse actually that we don't have the facilities, and UK has it. There is a difference, but whoever wants to do anything, they really can do it. So it doesn't matter what you have or not. If you are passionate, you'll do everything, whether you're in Pakistan, whether you're in UK. So I do not agree to this excuse at all.
Okay, okay, that's your point of view. So I agree to you. So the next thing is about. So we have. That's what I'm. That's why I'm talking to you about research, because you are into it. And I have been seeing your profile as well, that you have done a lot of research work, and even now you are doing PhD. So what is the best advice that you want to give to any fresh graduate who wants to come to this research and wants to do the research in UK and take some postgraduate degree? So what is your advice to them?
Hmm. Yeah, my advice would be, that if know your interests first of all, and just be ready. If you're coming to UK, just get ready for the roller coaster ride, and it's a whole different world, I would say. And if you are passionate enough, um, you'll be able to do it. You need to know your aim basically, whether you want to get a degree to get a faculty position in Pakistan, whether you want to do a degree to pursue your studies even more, whether you want to do a degree uh, to do some kind of change in a world. So it totally depends upon and you want to do a degree to stay here in UK. So there is different categories of dentists who wants to come to UK, and be honest to yourself and then plan your journeys. And if you're passionate enough, you'll find out a way. And do look for scholarships. This is my biggest tip. Do look for scholarships from Pakistan and even from UK. You need to be extremely lucky to get a scholarship from UK, but if not, start looking from Pakistan, and
Mhm.
keep on exploring, and you'll find a way definitely. And then the luckiest and the great part is that you'll get a post-study work visa here in UK from 2021. So that's a great news for all of the dentists and all the international dentists, I would say. So
Okay.
just be true to yourself. Yeah.
Okay, let's suppose if I don't get any scholarship here in from Pakistan, I take admission and I come to UK. There is a possibility that I can find a scholarship there during my master's or PhD degree. Is it right?
Yeah, that's correct, because I didn't have the scholarship, and I did get scholarship here. And but as I said, there are a lot of factors in between. It's the UK scholarships last from year one to year end. So if you're lucky enough, you can get the scholarship from UK university straight away.
From the
And
university where you have taken admission, right?
yeah,
Or or
yeah,
there are other organizations as well who are ready to fund your studies.
your project can be funded, but
Okay.
basically universities also gives it to the excellent students. You need to pass some exams for it, I think. Yeah.
Okay. 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 Okay.
And especially NHS, if you're doing some NHS studies, you can get funding from NHS studies as well.
So
Yeah.
you have an experience of teaching here in Pakistan, and also as an assistant professor in a very renowned institute. I would say the Bakai Dental College, and you also have an experience of working there in UK. So is there any difference in the work environment?
Definitely there is a difference. There is a lot of difference.
Yeah, I know.
Definitely, because and now this year I would say this is COVID, and I'm still teaching here also. That now we have this blended learning in which we have face-to-face sessions and then we have the online sessions. So I would say that do not expect here in UK. As a student, I'll speak as a student at first, that if you're a student, do not expect anyone to spoon feed you. Whatever you're going to do is you have to do everything by yourself. When you're coming to masters, you have to do everything by yourself. And when it comes to Pakistan studies, I would say it's more of a, we expect from students to, memorize everything, and it's more of like doing all of the just memorizing everything and passing exams in a different way. Whereas here, the students are different. They are more confident, and
Mhm.
the pattern of teaching is different. The curriculum is different. The courses are different. The practices is different. Everything is different. But I would not underestimate the curriculum we have in Pakistan. I would say that whatever I am from Pakistan definitely, because the kind of my skills, whether it's clinical or whether it's academic, in terms of memorizing things. Though I never used to remember anything, I'm really bad at cramming. So, but I think this came out to be the best place for me, because I didn't able to memorize everything. So I would just say that, like, there is a difference, but we do have a great um, curriculum as well in Pakistan. And because if you meet those standards, if you can memorize those big books and pass the exams, you can fit in anywhere. That's why we are everywhere.
Yeah, yeah, exactly, exactly. You're right. So, what was your motivation to do the PhD? So, you said you need to be very much motivated to do PhD. So, what exactly was your motivation to do it?
Yeah, I would just tell you, but I'm just saying that people will get bored of this session because it's too long right now. But my motivation was just saying that my motivation was, um, as I said, that when I went back to Pakistan after my master's, that was my first step to understand what research is actually. And here in UK, as you're asking about the difference, this is a big difference as well, that studies are research oriented here. The curriculum is research oriented here. So you always need to think critically to do anything. So my motivation was, I would say, my mother and my brother, because
Hmm.
I would say, the kind of disease they were suffering from. um, I just wanted to explore that why, like how. So that's how I came to UK to do research on those diseases.
Okay, so that is really, I mean, I would say that that is a really a good cause. I mean, you have taken it, made it your, what you can say, your goal for your PhD. So that's a really good cause that you are doing. So in the end, any specific message that you want to convey to all the viewers who are going to see your interview and who are exactly with us right now?
I think I have covered up a lot of things. I would just say to the students, my students, your students, all the dentists, that you know your interests, and nothing is impossible. You'll find your way out. And I might not reply you straight away. You can always contact me, but I will definitely reply you. The thing is, I also want to say, because I've got this platform, that I stay extremely busy and I don't find out time to talk to everyone. But I'm there. You can definitely contact me. The best way to contact me is definitely emails, not the social media platforms, because I don't go there too much. But yeah, and I would say just all the best for your careers, and um, just do not underestimate anything or our studies. And there is a great opportunities here in UK and all over the world. Just stay consistent and be motivated. And I
Well,
think I got a question right.
you've got a question?
It's the same one, is it?
That's the same
Another
question. Yeah,
one?
that's the same question. You covered it. Yeah.
Okay, okay.
So, so thank you very much, Dr. Rabia. It was really pleasure talking to you, and thank you so much for taking out your time. And you indeed are a very good speaker. I had seen few of your lectures that you delivered, and inshallah, we'll make sure that someday you also take out some time and talk about these research things for the DentoScope audience, so that they can also get some useful information from you.
Thank you, Dr. Rashid, for inviting me for this session. And it was indeed pleasure talking to you. And I hope that I gave some kind of information to all of the dentists. And feel free, all of the dentists, to contact you or me. And then,
Yeah, if there are any questions which they want to ask, they can simply comment on this interview in the comment section, and I will convey it to Dr. Rabia, or she will answer it herself. This interview is going to be broadcasted on YouTube within 12 to 13 hours from now. So thank you so much, Dr. Rabia, once again. Inshallah, hoping to get you soon on this our YouTube channel for another session on the research related topics. Thank you so much.
thank you so much, Dr. Rashid. Bye.
Okay, take care. Bye.